Welcome back, future heroes. In our last episode, we focused on communication and documentation. Today, we're diving into the core of EMS work, patient assessment and emergency interventions, with a focus on pediatric care. Let's tune in and see how our dynamic duo handles a challenging call involving a child.
This is Captain Dave, coming at you on First Responder Radio. We're about to get our learning on with some EMS pediatric care. You know, treating kids requires special approaches, as they can become your worst nightmare. I remember a call where a child's trust in us made all the difference in providing effective care. Once they decide you're scary, ain't nothing going to make the screaming stop. So pay close attention to today's lesson. It could help you save a young life one day.
All right, let's start with the basics. What's different about assessing pediatric patients?
With kids, we need to be extra observant. They might not be able to communicate their symptoms clearly, so we rely more on visual cues and vital signs. Also, their physiology is different from adults, so normal values vary by age.
Exactly. And what's crucial when approaching a pediatric patient?
Building trust is key. We need to be gentle, speak calmly, and if possible, get down to their eye level. It's also important to involve the parents or caregivers, as they can provide valuable information and help keep the child calm.
Good. Now, what vital signs should we pay special attention to in children?
Respiratory rate is crucial in kids. They can compensate for respiratory distress for a while, but when they crash, it happens fast. We also need to check heart rate, as tachycardia can be an early sign of shock in children.
Perfect. Let's talk about pain assessment in children. What tools can we use?
For younger kids, we might use the FLACC scale, face, legs, activity, cry, consolability, or picture scales like the Wong-Baker faces scale. For older children, we can use numerical scales, but we need to ensure they understand the concept.
Excellent. What about immobilization techniques for pediatric patients?
We need to use appropriately sized equipment. For spinal immobilization, we might use a pediatric backboard or a car seat for infants. It's crucial to pad any voids to prevent movement during transport.
Ambulance 26, respond to Wilson Park at 123 Wilmington Avenue, Compton. 5-year-old male, fall injury from playground equipment. Parent on scene.
You heard it, Zeke. Let's roll. What's our approach for this call?
We need to be prepared for potential head, neck, or spinal injuries. Let's also bring our pediatric assessment kit and be ready to manage pain and anxiety in a young patient.
Good thinking. How should we approach the scene?
We'll do a quick scene safety assessment and then approach calmly. We don't want to scare the child or escalate the situation. Let's get down to his level and introduce ourselves to both the child and the parent.
Perfect. What's our initial assessment going to look like?
We'll start with the pediatric assessment triangle: appearance, work of breathing, and circulation to skin. This gives us a quick overall impression. Then we'll move on to the ABCs, paying special attention to any signs of head or neck injury.
Excellent. And how will we handle pain management for a 5-year-old?
We'll use age-appropriate pain scales and consider non-pharmacological methods first, like distraction or positioning. If medication is needed, we'll calculate the dose based on the child's weight.
Great. What about immobilization if we suspect a spinal injury?
We'll use a pediatric-sized cervical collar and backboard if necessary. We'll explain everything we're doing to both the child and the parent.
Great. What about immobilization if we suspect a Colles fracture?
For a potential Colles fracture, we'll need to immobilize the entire forearm, wrist, and hand. Let's grab the pediatric splint kit.
Good thinking. How do we assess for a Colles fracture in a child?
We'll look for the classic dinner fork deformity, but it might be less pronounced in a child. We'll also check for swelling, bruising, and tenderness around the wrist. Children's bones are more flexible, so they might have a green stick fracture instead of a complete break, but the worst case scenario is the growth plate being damaged and not corrected. That's why we take the Colles fracture so seriously.
Excellent. What's our approach to pain management for this situation?
We'll start with non-pharmacological methods like distraction and positioning. Ice packs can help reduce pain, but there's really not much more we can do.
Perfect. How do we explain the splinting process to a 5-year-old?
we'll use simple language and maybe a bit of imagination. We could say something like, we're going to give your arm a special superhero cast to help it feel better and keep it safe.
Great idea. What materials will we use for splinting?
We'll use a padded aluminum or a softer, formable splint that we can mold to the patient's correct size. We need to ensure it extends from above the elbow to beyond the fingertips, maintaining the hand in a position of function.
Correct. And how do we apply the splint?
First, we'll gently support the arm and assess distal circulation, sensation, and motor function. Then we'll apply padding, especially over bony prominences. We'll mold the splint to the arm's contours, making sure not to create pressure points. Finally, we'll secure it with an elastic bandage, being careful not to wrap too tightly.
Excellent. What signs should we watch for after splinting?
We need to regularly check circulation, sensation, and movement in the fingers. Any numbness, increased pain, or color changes could indicate the splint is too tight.
Perfect. Now, how do we handle the parents during this process?
We'll keep them informed every step of the way. We can involve them in comforting the child and explain the importance of keeping the arm still during transport. We should also prepare them for what to expect at the hospital.
Great point. What about transport considerations?
We'll need to secure the child properly, ensuring the splinted arm is supported and protected from further movement. We might use pillows or blankets for additional support.
Excellent. You're really handling this well. Remember, our calm demeanor can help keep both the child and parents relaxed.
Absolutely. Treating pediatric patients requires extra patience and empathy. We're not just treating the injury, we're caring for the whole family.
Zeke and Anya have just given us a wonderful lesson in handling a potential Colles fracture in a pediatric patient. From assessment to splinting to patient communication, they've shown how EMS professionals need to adapt their skills for young patients. Remember, treating children requires extra care, patience, and creativity.
That's right. Zeke and Anya demonstrated the importance of combining technical skills with a child-friendly approach. They also highlighted the significance of involving and supporting the parents throughout the process.
It's clear that being an EMT requires not just medical knowledge, but also the ability to adapt to different patient needs and age groups.
Remember, practice your pediatric assessment and treatment skills regularly. Always be prepared to think on your feet and find creative ways to make children feel safe and comfortable during treatment. And never underestimate the importance of clear communication with both the patient and their family. Well, that concludes another lesson. For homework, go back and review all lessons to this point. Next lesson concludes this course, so do yourself a favor by being prepared.